1 in 8 men are going to get prostate cancer. If you wait for symptoms, it might be too late.
But I think most blokes, in my experience anyway, don't talk about illness. Clearly cancer's a big scary word, isn't it?
More than 1.4 million men are diagnosed with prostate cancer each year, and it's the most common cancer in men over 45. So as November is Men's Health Awareness Month, we're this week revisiting a film that spotlights prostate cancer awareness and the need to prioritise regular screenings and health checkups. We'll hear from Dr Chidi Molokwu, consultant urologist here at the Trust, and one of his patients about the critical role early detection plays in improving outcomes for prostate cancer patients.
One in 8 men are going to get prostate cancer. If you wait for symptoms, it might be too late. Then you could sit silently while the prostate cancer progresses to a rate where it can't be cured.
I had no symptoms, and there was nothing painful. And when you haven't got any symptoms, it's difficult to gauge how serious it is.
So the symptoms that come with prostate cancer, for example, problems urinating, blood in the urine, pelvic pain, and so on, and the more relatives you have with prostate cancer carries on multiplying the increased risk. We found that prostate cancer is one of those things where people with an African ancestry have a higher risk than others.
I went to the doctors probably about 6 or 7 months ago with a blocked ear, and just as an afterthought, almost a throwaway line, could I have a PSA test? My PSA score was 31. The normal is 4 and below.
The PSA blood tests could be elevated for different reasons. That makes that test not perfect, but it's helpful.
They then put me on a series of scans, really. He showed me the enlarged prostate and the bits that are broken off. And he said, well, I can't operate because there's no guarantee of picking up these bits while I take your prostate out. So I'm not going to do it. It's inoperable. So I said to him, well, what happens if I don't have any treatment? And he says, you'll die early.
Easiest treatment for prostate cancer is just monitoring. You have a kind of cancer, right now it doesn't look aggressive, but at this point in time, it doesn't look like you need treatment, then we monitor. So that saves a lot of men having unnecessary treatment. And the reason is that all the treatments for prostate cancer are quite aggressive. So whether surgery or radiotherapy, it does have an impact on your lifestyle.
In November, I started radiology treatment once a week for 6 weeks. A few weeks after that, my PSA rating had gone down from 31 to 0.01. So it's been a really straightforward and painless procedure to get to the point where it's under control. They look after me and make sure that I live to a ripe old age. I wish I had done it earlier. They would have been able to operate and remove the prostate, which would have meant that ongoing medication was unnecessary. There's no sense in not having it done. There's no point in carrying on with it and risking pain and early death.
I would say the main problem is a lack of awareness of what a prostate is, what kind of problems you can get with your prostate. There's about 45,000 men diagnosed every year. Men are not presenting early enough to their doctors to actually then be referred on for treatment. So from my experience of doing these awareness campaigns, a lot of men don't even know they have a prostate. It actually allows people to talk about it, ask questions.
But I think most blokes, in my experience anyway, don't talk about illness. Clearly cancer's a big scary word, isn't it? I've told all my friends, all my male friends, there isn't anything about it that's remotely awkward or painful.
So fundamentally what I would like is every man will know that when they turn 50 or 50-ish, they should get a check. Every man will know that if they have problems passing urine, they should get a check. Your GP should always be your first port of call if you've got any health concerns. Yorkshire, we have all the treatment centers. We're here waiting to treat you, but we can't treat you if you don't actually show up.
Get checked, go to your GP and get a blood test. It's painless and could save your life.